Hello students, this is Dr. Henry and I'm your instructor for DAT 120, which is Office Administration for Dental Assisting Students. This is a quick little lecture video for Chapter 12. Chapter 12 discusses scheduling in order to optimize your dental practice's efficiency. All right, so the bulk of the chapter does talk about scheduling, and scheduling is a very important concern for any medical practice, dentals, whether it's podiatry, cardiology, whatever medical specialty you happen to be working in. It's very important because this, as you see on the screen, relates to a lot of different things that will determine the health of that particular practice. So, whether the practice is profitable, whether it makes money, whether there is a good quality of care or focus on customer care or patient care, that is reflected in the way that a practice schedules their appointments. The emotional and physical well being of the staff is also reflected in scheduling, and then convenience for your particular patients. All right, so if you don't have appointments or if you don't set pre-established appointments, you don't know if you're going to make any money. So you want to get appointments on the book. As it relates to quality of care, the way that you schedule appointments will determine whether you care about patients or staff. Because if you have them too close together where staff doesn't have time to properly clean or to take breaks, all of that will impact your particular practice and whether patients come back or not and whether staff stays or not. And then, of course, you want it to be convenient to the health of the patient. Some procedures take longer, some procedures don't take as much time. And so that has to be reflected in how you schedule. Other things that are relevant to the patient schedule is your dentist preferences. So, they may prefer to do different kinds of procedures earlier in the day, later in the day, depending on the kind of practice it is. For example, if it caters to older adults, they may start earlier. If they cater to children, they may work a little later. They may even be open on weekends. All of this has to be, factored in when you're setting up your schedule. And you always want to maximize production. You don't want to have gaps in your schedule where you have time where you're not seeing a patient. You don't want to be overloaded, but you don't want to be under loaded, if you will, either. You want to have a productive schedule, which means that you have every available appointment slot filled to the best of your ability. But of course, you need to consider the treatment rooms, the facilities that you have, the number of staff that you have. All of that has to be taken into account, and you'll see as we go through. All right, so sometimes you have to block out times. If your particular practice does, daily meetings at 6:30, where you're not going to have patients in when you need to do daily meetings. If you have weekly meetings, if you have clinical education or professional development education classes, or if they're going to be done at your particular work site, you don't want to have patients scheduled during that time unless you're able to stagger staff, or part of the staff is in the class and part of the staff is working with patients. So sometimes you have to block out time. Also, how your particular practice handles emergencies is important because sometimes you don't know when or how an emergency may arise, but if one of your patients has an emergency and they need to come in right away, there should be some wiggle room in your schedule that allows for them to do that without throwing off your entire schedule for that particular day. And then, of course, you always want to have time for cleanup and setup, to prepare a room before the first patient comes, to clean up after they leave and get it ready for the next patient. All of that time has to be factored in on your schedule. Double booking and staggering appointments. This is going to depend on how many exam rooms your particular practice has. It's going to depend on how much staff your practice has. Because if you, some practices are able to take 3 9 a.m. appointments, and then some are not. So if you have multiple exam rooms, depending on the procedure, then you can do that. And sometimes I know there are sometimes families that want to come together. You may have, the mom, the dad, and the two kids coming at the same time. So that would be 4 appointments. How does your practice handle that? So it all depends on, of course, the number of staff and type of staff you have, as well as the number of rooms, exam rooms, for different procedure treatment rooms that you have. All of that has to be taken into account. But when you know or understand your particular dental practice's, layout and procedures for scheduling appointments, then you just follow the pattern that they have set. If they take appointments every 30 minutes or every 15 minutes, you fall in line and make sure that you're scheduling in accordance with what they have and not outside of those parameters. Sometimes you have patients who have special needs, if they have challenges with walking or if they have certain kinds of conditions, it may require, extra time. And so you can schedule around these types of patients. For example, they could be, in and around your exam rooms that you have preserved for emergencies or surgeries. So if you don't have any surgeries that day, you may schedule their particular procedure in that room, for example. So those who have special needs, those who are having special procedures done, there should be a established procedure at your dental practice with how you organize that. And so the main thing for you as a dental assistant going to a dental practice is finding out how your particular dental practice operates. That's going to determine how you yourself conduct yourself as a staff member, because here with the author of our book, all the concepts that are mentioned are talking about things that you need to be aware of, but your particular dental practice is going to have a procedure. And so what you want to do is find out what your dental practice does. How does your practice handle these things? And you want to learn that so that if you're ever called upon to make a schedule or to schedule a patient, you will be able to do so effectively, efficiently, and without interrupting any other patient's appointments. All right, classifications of emergencies. There are different kinds of emergencies. Some, emergencies are real emergencies, and some are perceived emergencies by the patient. So, according to our book, a true emergency is a trauma of some sort. So, the examples that they give are, an automobile accident or a tooth knocked out of socket or jaw fracture. These are true emergencies that have to be attended to right away. And so sometimes patients will say, hey, I woke up with pain in my tooth and this is an emergency. Well, maybe not. If it's an existing patient, you may want to go through their chart to see what kinds of things that they have been dealing with or working with. So there are levels of emergencies, and that's another thing that your particular dental practice will have to be aware of when it comes to scheduling. Also, palliative care. Unfortunately, there are some people who are less than honest, and they may be only interested in getting pain medications. But then, of course, you also have those who are generally in pain and who do need, to be treated palliatively. So they'll get those meds to lessen or reduce their pain. And so the dentist, you as a dental assistant working with your dentist will have to look at the holistic view of the patient. Is it an existing patient? Is it a new patient? What are they presenting with? Once examined, does what you see line up with what they're saying? So all of those things have to be considered. And so that's what this particular side kind of talks about. You want to screen those emergencies. You want to look at, the extent of the issue, when it started, how long it's been going on, all of those things before you do consider dispensing pain medicine. All right, so when you're recording appointments, it's best to give the patient options. Here, your book talks about giving them two different options. normally you want to schedule when the patient is there with you. So if they're coming in or they're there for a cleaning, you want to schedule them for their next appointment before they even leave. And so at that point, they can tell you, hey, I'm free on Thursday mornings or Saturdays or whatever day. So you can schedule around their times then. And you always want to make sure, of course, that you're accurate and correct when you're scheduling appointments. And if they are having a procedure that has multiple steps or, sequential appointments, you want to make sure you schedule all of those while they're there, because it would be very disheartening for a patient if they're coming in for the first part and they can't get the second part done because they can't get in. So you want to schedule sequential or multiple step procedure appointments at the same time. And there are a lot of practices that still give a appointment card. So a paper card or a little bitty, kind of card, stock card. There are a lot of those that do these virtually. So sometimes they'll send a text reminder of an appointment, or they will email the patient their date and time. So you also want to flow with what your particular dental practice does. And you want to make sure you know what it is before you even schedule the patient's appointment. So getting introduced and oriented to your dental practice, I can't stress how important that is, because if you say, hey, hang on, I'll give you an appointment card, and then you go to the office manager and they're like, oh no, we don't have cards, we do email reminders or texts or something like that, then you have to come back to the patient and it doesn't look professional. So you want to know before you even interact with patients. Confirming appointments. Some do calls. A lot of offices now are emailing patients. I know my particular dental practice, they email you, I want to say a good week ahead. It might be a little bit more than a week, but definitely a week before your appointment. Now, of course, I normally make my appointment while I'm there. So it'll be 6 months in advance that I've made the appointment, and the office lady, I know that it pops in my email and says, hey, you have an appointment scheduled for this day and time. Are you still going to be able to keep it? And so normally I can just shoot back, yes, I'm going to be there, and it's done. So some offices do have automated systems that allow them to do this. And then some, of course, have receptionists or office assistants that will make these calls. It is important to maintain that HIPAA privacy, so you don't want to be putting too much information on their voicemail or text, that you don't want to use sensitive patient information in those instances. Now, from time to time, you may have to deal with late patients or patients who are habitually late. Here again, your office should have a procedure about how they handle this, because some patients you already know, oh, so-and-so is going to be late, or maybe you don't know and it's a new patient and they're late. So what is the procedure at your particular patient, at your particular practice? Are you going to do less things than what was planned? Are you going to reschedule them, say, hey, we can't see you today? Are you going to tell them, hey, you're going to have to wait until we see others? I definitely do not recommend delaying other patients because they're late, but that is one of the things listed here from your author, from the book author. But if in any event, you need to have a plan, especially for those that are chronically late. So I don't know if you tell them, hey, we're going to put you down at 9, but your real appointment at 9:30 or something like that. I don't know, but you definitely want to have a plan, and your practice needs to have a plan. And so a lot of the practices that I deal with, they will give you a within window. So they're like, if you're over 5 minutes, you got to reschedule, or if it's over 10 minutes, you got to reschedule. So they'll have parameters that patients have to adhere to. You want to also maintain a call list. Sometimes it's hard for patients to get in, depending on how busy your practice is. If there is a wait list, you want to make sure that you know where it is and have it handy for when people reschedule and can possibly move up in the list. There is a daily schedule sometimes that each practice maintains that tells you what kinds of procedures are happening today, when are they happening, where are they happening, what exam room. You need to familiarize yourself with this. It's normally only for staff eyes only. And then recalls, if you have people who haven't been seen in a while and it's time for their visit, you don't want to lose them. You want to call them in for their appointments. And of course, your particular dental practice might have an automated system that helps them with this as well. And when you're confirming appointments, you want to speak to the person and not just leave a voicemail to say that it is a truly confirmed appointment. Hopefully, this was helpful. Thanks for watching. Bye.